Imagine this. A child in a rural village miles from the nearest hospital is diagnosed with pneumonia, not by the doctor, by an AI from a smartphone. That child survives, not because a specialist was flown in, but because technology filled the gap. That's not science fiction. That's already happening. Good morning. I'm Mick Hacker. I'm not a doctor or a scientist. I'm part of a generation growing up with artificial intelligence in medicine. And today, I want to explore what that means, especially for us. Here's how I'll break it down. What AI can do, what it's doing now, real-life examples, the challenges ahead, and most importantly, the future of healthcare. Every year, millions of people die, not because their diseases are untreatable, but because they're diagnosed too late or they're never diagnosed at all. Many of them are young people, just like us. The World Health Organization estimates that nearly half the world lacks access to essential healthcare services. That's billions of people without access to basic care. The AI is starting to fill that gap. AI doesn't get tired. It doesn't need sleep. It can scan images, monitor symptoms, and analyze data 24/7. It can detect warning signs early, even when doctors are not around. And it's not just about access. It's also about accuracy. In some studies, AI has matched or even outperformed doctors in detecting conditions like breast cancer and skin lesions. This doesn't mean people will be replaced. It means professionals can make better decisions with intelligence by their side. Well, what does AI medicine actually look like right now? First, in medical imaging. AI scans X-rays, MRIs, and CT scans to find things that people can miss. Second is they can act like virtual health assistants, something that can tell you when it's time to see a doctor. Next, drug discovery. AI can analyze drugs to save lots of time and money researching. AI can have personalized medicine, and it can also monitor remotely. This is the beginning. Jack Andronka is a 15-year-old who created a pancreatic cancer test using AI-driven data analysis. It was faster and much cheaper than existing methods. Salman Bakshi started coding at 5, and at 14, he was working with IBM on AI tools to help people with disabilities communicate more easily. These aren't isolated cases. These are examples of what AI can happen when young people take initiative, ask questions, and learn the tools of change. You don't have to wait for a degree. You don't have to wait at all. But we need to be clear. This future isn't guaranteed. There are some real challenges, like bias. If AI is trained mostly on data from certain populations, it might misdiagnose others, which is a pretty dangerous glitch. Next, privacy. Health data is personal. If tools aren't built with strong protections, people's lives can be exposed. Access. If only rich countries can afford these tools, artificial intelligence will widen the health gap instead of closing it. The solution isn't to abandon AI, it's to build it better, with fairness, ethics, and global accessibility in mind. That means now we need voices in this conversation. So, what can we actually do today? Now first, just learn to code or think beyond my code. You don't need to be a coder, but you do need to be curious. Second is to get involved. Programs like AI for All, Inspire AI, and healthcare hackathons are made for students. Join one, start a project, collaborate with others to solve problems. Or you can ask better questions. Who benefits? Who's left out? What tools heal and what tools harm? So, I'll leave you with this. To dream boldly. The world doesn't change with just small ideas. To think ethically. Because AI, without ethics, is just a code. To build fearlessly. Don't wait until someone tells you you're ready. And connect deeply. Because technology without connection isn't enough. Thank you.